Today our webinar is Green Cleaning and Healthy Students, and we are very excited that you were able to all join us. Again, let me start with a little bit about who we are. We're Healthy Schools Campaign. We are a nonprofit located in Chicago, and we work on supporting health and environmental policies within schools because we believe in a common sense notion that a healthy student is going to be a more successful student, and we have a responsibility of ensuring that health is integrated into every part of the educational environment. So before we get started, I want to tell you a little bit. This summer we've had and are continuing to have a series of green cleaning webinars. We still have a handful of them coming up. So 4 of them. The school administrator's role in a successful green cleaning program, the Green Cleaning Awards for schools and university about applying for the award. We have learning from the leaders, highlighting the recent winners of the 2012 award, as well as a teacher's role in a successful green cleaning program. So please help us spread the word, share it with all your colleagues, and let them know that there's a lot of information to be shared, to be learned, and helping us have healthier environments for our kids. Also, be part of the conversation. Join us. If you guys are on Twitter, on Facebook, please share it. If you have questions, ask them now. Ask them later. We love for you to be involved in all of our social media efforts because we want to make sure that we're all aware and all part of the conversation about healthy school environments. A little bit about logistics. This webinar we're planning on approximately 1 hour. If it runs over, we'll look into it and talk to you about that at that point. There will be a recording of the webinar available online. It will be on hopefully by early next week. That will include copies of the slides. So if you have that question, let it be known right now. You can, you can download the actual presentations. You can also download the audio and video of this. And the link will go out to everybody who is registered for this webinar. And the last thing is, at the end of this, when you leave, there's a very short, it says 1-minute survey at the end. It's actually less. It's 1 question. You probably can finish it in about 30 seconds. Please take it. We read them, and we do make changes to our future presentations based on that input. We really value what you say. So please take that time to give us your opinions. Also, we're going to try to dedicate at least 15 minutes of Q&A at the end. So think of your questions and ask them at any point. We're going to ask you to ask questions through the questions box in the sidebar on your GoToWebinar administration session. So type those questions in, and we will go through them at the end. We'll categorize them, make sure that as many questions as possible get answered. So let's see. Now, having said that, we're going to get to today's speakers. Of course, I can say myself. I am Mark Bishop, Vice President of Communications at the Healthy Schools Campaign. Additionally, we have Linda Mendonca, school nurse from Island, and Deb Stafford from Green Chimneys Schools. But we're excited to have them here in advance. A little bit about Healthy Schools Campaign, but one of the reasons why we're here today is because one of our programs at keeping healthy school environments is around green cleaning. We have been publishing the Quick and Easy Guide to Green Cleaning in School since 2006, and we use that as our platform to talk about healthy schools, environments, and how to make sure that we have a healthful cleaning programs in all of our schools. This is our platform for engagement, education with school communities, with parents, teachers, administrators, but also with the cleaning industry, and making sure that the cleaning manufacturers, cleaning distributors, service providers understand the value and the rationale behind healthier cleaning programs and more sustainable cleaning programs. Also, if you want to, get onto our website of greencleanschools.org. You can sign up for our quarterly newsletter that goes out with information about green cleaning, strategies for implementation. You know, we also do numbers of promotions, speaking engagements, webinars, trying to get the word out. One of the exciting parts about the work is the reach that we have, and we are constantly looking to our national partners, educational and health organizations that help us extend the message great organizations and friends such as American Federation of Teachers, the Green Cleaning Network, Parents for Public Schools, and of course I must point out today the National Association of School Nurses. So thank you so much. Now, we're here for a webinar about green cleaning, so the first question that I want to answer, and I'm not going to go into depth because we've got two great speakers that are going to go into more information than I have to go into, but I want to talk about briefly what is green cleaning. And the way we define it at Healthy Schools campaign is green cleaning is cleaning to protect health without harming the environment. And the reality is when we define cleaning as cleaning to protect health. That's why we clean. We clean because we want to make sure we keep our students, our staff, the occupants in our buildings healthy. We want to make sure we are limiting the spread of infectious disease. We want to make sure we're limiting bringing in pollutants and potential harmful pathogens into our buildings. Green cleaning takes that a step further and makes sure we're not harming the environment. And we define the environment both indoor and outdoor. We don't want to harm the global environment. We want to look at transportation systems, how we get chemicals and products to and from our schools. We want to make sure the manufacturing process is done in a way that minimizes the footprint on the earth to make sure that we are preserving our environment for our children. Additionally, we want to make sure we're looking at the indoor environment and that the chemicals and the products and the processes that we are using indoors allows us to create a minimal exposure to potential pollutants and potential toxins to our students, to our staff. Because again, we believe a healthy student is ultimately going to be a more successful student and going to lead to more successful schools. Last thing about cleaning to protect health without harming the environment, I just want to say that's a very important and deliberative order. The first thing we prioritize is health, and that is always number one. So when you talk about green cleaning, people say, oh, but that is not about, you can't control infection. You cannot kill germs if you have a green cleaning program. It's not true. We focus on cleaning health, and the number one thing we want to focus on is making sure we're doing things to keep people healthy, which includes proper cleaning, proper identifying of soil surfaces, and also proper infection control where necessary. Now, why do we care about green cleaning? Again, very briefly, we highlight 4 or 5 main areas, and I know in the first two, our next speaker is going to go into more detail, so I don't have to, but it's about keeping students healthy, keeping them in the classroom. It's about keeping our custodial staff, our teachers, our administrators healthy, making sure we're keeping people attentive in the classrooms. We're not actually putting money into our healthcare system, but we're keeping it into the education system. But we also want to say green cleaning is about increasing the lifespan of our facilities and making sure that we have processes in place that don't wear down surfaces, that don't wear down carpets, that make sure that we are doing proper maintenance, that keep our facilities in working order. It's about preserving the environment, as I mentioned earlier. And finally, it is about fiscal responsibility, because green cleaning programs are about using our workforce with proper, modern, up-to-date processes with current technologies that help us more efficiently use or more efficiently run our building. What we've heard from all of the schools that we have been working with on green cleaning is part of green cleaning is effective because it works efficiently and it helps school custodial programs save money and become more effective in the long run. Okay, having said that, let's move on. I want to introduce our first speaker. Before I do so, let us put up a poll. I want to know a little bit about who you are. So please take a moment and answer the question. And besides that, I'm going to introduce Linda. So Linda Medanza, she's been a registered nurse for 30 years, practicing school nursing for the past 20. Her school nursing career has included experience with pre-K to high school, with the last 10 years focusing on adolescents in middle school and most recently adding high school students to her building. Linda is very passionate about environmental health, and she incorporates this aspect daily into her school nursing practice. She currently serves as chair for the Rhode Island Leadership Board for the American Lung Association, has been involved with the Rhode Island Department of Health Asthma in Schools Subcommittee for many years. So with that, I want to thank Linda for her participation. And real quick, let's find out is participating. It looks like we got a number of school nurses, manufacturers, building engineers, nonprofits, pretty much across the board. So for everyone who is here, thank you so much. And Linda, I would like to give you the virtual gavel, so it's all yours. Linda.
Okay, thank you, Mark. I appreciate it. Thank you for asking me to participate in the webinar today. This is great. Okay, so we know who I am, so we'll go to the next slide. And I just want to talk a little bit about the school nurse's role. School nurse has a lot to do every day, and sometimes we don't get to, incorporate everything. And thinking about environmental health is important, and it may be overlooked at times, but it's a way that the nurse can be an advocate by supporting certain environmental issues. Just being aware about their school building that they're working in to make sure that there is a level of cleanliness and maintenance issues are being addressed properly. Learning about what cleaning products might be used and the practices for cleaning, knowing where the MNCS sheets are in their building. If they can, advocating for training of custodial staff, and then, of course, addressing any student, staff, or parent concerns regarding environmental issues. Being the only health provider most of the time in the school setting, these things may not be looked at in the same way as a nurse would, as administrators don't always think about it. So it's certainly important for the school nurse to be thinking about environmental health within their school building. Next slide, please. There are some challenges to that. Schools are very densely occupied spaces. They're heavily used. I know my building is used after school for Parks and Rec, and there's a community theater that uses the building, so it's used almost 24 hours a day. If it could, probably would be. So there are spaces that, get well used. Over half of the schools across our nation have some kind of indoor environmental quality problem. And as most of you are aware, I'm sure, that children are more vulnerable than adults to toxins, which, toxins are around in our schools. So the children definitely have a much more, vulnerability rate than an adult. Next slide, please. Looking at the health impacts of the poor environment, indoor environment. Asthma is really a big factor. There's so many triggers within a school building. The numbers up there kind of give you a little bit of data as far as how many people suffer from asthma. The big one there is that 14 million missed school days each year. That's huge, due to asthma. And the cost to society. I mean, it's a burden on the society. The medical and the indirect costs. It's pretty astounding. Sick building syndrome, I'm sure you're familiar with, and illnesses that are related to the building, whether it's mold, poor ventilation, those kinds of things. That's a problem for students and for staff. Lots of allergies, and this time of year is a crazy time anyway with what's going on outside with the allergies. But it certainly affects the students inside. I actually ran out of I'm allowed to give over-the-counter like a Benadryl. I ran out yesterday because I've been seeing so many kids. And then kids with like little rashes all over their arms. And my school building is not the best place, let me tell you that. And it's just been, astounding to see the numbers of kids coming to see me. But, there's the quality of the school affects the absenteeism, as I said. And then, when you're lived in a room with the poor air quality, it's going to affect your production and how you're learning, and it's going to make the test scores, a lot less than what you want them to be. So the academic performance is certainly affected. Next slide, please. This is just a nice visual, just kind of showing you, say an average classroom of around 30 students, you're going to find probably 3 students that do suffer from asthma. So, just to give you an idea of, what we're looking at. And again, asthma isn't the only thing that, people are affected with having a poor indoor quality, but it certainly definitely affects them. Next slide. So we know there's a problem in many of our schools and what it can do, for the students and staff who are in them, so many hours, 5 days a week. There is a solution, and as Mark has alluded to already, is clean for healthy schools, green cleaning and cleaning. And the definition that I use is cleaning that protects public health without harming the health of children, personnel, and the environment. That's just a basic kind of definition there of that. Next slide, please. Some of the benefits of cleaning for healthy schools would be to reduce the airborne dust, reduce VOCs. Just a Lysol spray has so many VOCs, and that's what they, like in my school, we're trying to switch that, but that's what they still want us to order, to use for an air freshener. The vents in my bathrooms don't work, and so they want us to use that, and it's really not a good thing. But reducing the bacteria and the total fungi, those are some of the benefits that you'll get from cleaning for healthy schools. Next slide, please. The principles of cleaning for healthy schools, are to keep the dirt out, using a less toxic third-party certified cleaner, paper products, hand soaps, updating and maintaining equipment, and cleaning with all-purpose cleaners that disinfect like target areas, those touch spots, doorknobs, those kinds of things. You don't need to totally fumigate the whole place, but look at those hot spots or touch spots that people are always the germs are going to be, dust, toxic dust, that kind of thing. And being clean doesn't need to have an odor. You don't need to smell the bleach to know that somebody's been in there cleaning. That's such a myth, and people think that the custodian hasn't come in to do something if they can't smell that clean smell or whatever. Next slide, please. So this just kind of looks at some of the key elements for successful cleaning for schools. It's something that, as a school nurse, that I really have taken on as a challenge, I guess, because it hasn't been easy. I don't mean to be discouraging, and it's something I still work very hard at, so I haven't given up. But sometimes there are some challenges in trying to form a team, like Tools for Schools, for instance. I'm not going to get into all of that here, but that's a team that just kind of looks at the school environment, having some certain key players in the school doing that. But the school nurse can be the one to really step up to the plate and say, hey, look, we really need to be doing that in in our building. So that's a place to start. And when you do that, you use a checklist. So you might be evaluating and looking at the cleaning products that are being currently used. You can educate building occupants and reach out to the community, such as the health department, the local hospital, whoever can help you with education. Working with some kind of a health and safety committee. Do a pilot project and test 1 or 2 products. Nobody's saying you have to go in and clean out the cupboard and start ordering, green cleaning supplies. You can start with just a few and take it one step at a time. Training staff is really important that that gets done, that the custodians know what they're using and know how to use it properly. Tracking success, like looking at the school nurses' logs, making sure that there aren't a lot of kids still coming down for, asthma attacks, or like I said, what was happening in my office the last week. So looking at that and looking at attendance rates. Rewarding staff for participating. I know I've just been involved the last year. I'm working on my master's in advanced public health at Rush University, and I did clinical at the Department of Health working with the Asthma Coalition, and we're doing a pilot study on, it's called Project Case, and it's controlling asthma in schools effectively, and we've done some interventions. And after doing a walkthrough, we found that teachers had piled up all kinds of stuff on top of the vent. They had food in the room, and it was just which attract pests, and which isn't a good thing. So anyway, the principal agreed to give all of the teachers these brand new Rubbermaid containers to put things in and to move the things off of their cabinets. So they were given the resources that they needed to help to make the environment in their classrooms a much better place. Public promotion, and that could be like the award, maybe applying for an award and then adopting a local policy. Next slide, please. This looks a little bit at the cleaning products. I'm not an expert at this. I think there are some people on this call, after looking at the poll, that certainly have much more knowledge of products and so forth. I don't claim to be an expert, but they must, in the building be stored in a safe, secure location where students don't have access to them, or staff. Even staff shouldn't be going and helping themselves to things and using them in the classroom. And they should be used by people who are trained to use them. And again, following the directions of the manufacturer and having those MSD sheets available for quick reference in case there's a problem. Next slide. Just a little bit about workers. This just gives you a few little statistics about a custodial worker and how much chemicals they might use, in a year's time. And their, rate of occupational hazard is pretty high because they are using, around these chemicals. And 6 out of 100 custodians are injured each year from different kinds of injuries. In a school in my district, I think it was like 5 years ago or so, one of the custodians took graffiti cleaner, which was supposed to be used only on the outside of the building because the fumes were just like so toxic. He thought he would use it inside on this. They had these big watch sink things that little kids could stand around, so like 15 kids could stand around it, and he decided to use it inside the building to clean up the graffiti. Well, let's just say it was a huge problem. The building had to be evacuated. He just didn't have the knowledge and didn't understand and didn't know, didn't have the proper training. So it's so important, that they do get the training that they need. And also, they need to be protected. One of the custodians that worked in my building, he actually is on disability now. He was a smoker, so he did have that going against him, but he also was working with these chemicals for so many years. He was only in his mid-40s, and I think he had the lung transplant, but he was awaiting a lung transplant, and his doctor attributed some of his lung disease to, they were using those strippers for wax and all of that stuff, and he attributed it to using, his occupational hazard as well as his smoking. So that's, mid-40s, that's pretty young. So it's important that they are aware. Next slide, please. Clean equipment is important. Making sure that you have good walk-off mats. Like I said, one of the principles is keeping the dirt outside of the building. So you want to make sure that you get it off of people's shoes as soon as they walk in and they're not tracking it through. Using the microfiber cloths and mops. Having the HEPA vacs and, good vacuum systems and all of those things. Again, like I said, I'm not an expert on, but they should be using it when things are being replaced in schools. Those are the things they should be looking at to purchase. Next slide, please. Just a little bit about third-party certifiers. Just make sure that they really are, green products. Lots of times they advertise and the labels aren't always reliable. So, just make sure that you're getting what you want and that it is actually certified. And, all-purpose cleaners and products, hand soap shouldn't be that antibacterial, as you know, that, people are building up the immunity again when they're using those soaps, and it's not necessary to have them. And then the paper products just being, chlorine-free or recycled, it would be nice. Tissues and towels on larger rolls, and just being conscious about what things are being purchased. And school nurses, I don't do that, but I certainly would be, be able to get some input, and hopefully the people that do that are doing it. But next slide. So. So here we are. We're not on Easy Street, unfortunately, but we have Strategy Street and Implementation Avenue. To do this, and again, I'm speaking from the perspective of a school nurse, I feel like I'm a champion in my building, but it's not easy. It is a challenge. You definitely have to have administrative support. Just a really quick story. I had a walkthrough in my building from a consultant that came from the Department of Health that they had contracted out. Came through did this wonderful walkthrough, wrote up a report, gave the report to me for me to share with our facilities manager in the district. He got the report. I tried several times to meet with him about it and got no response. I wanted to do a training for the custodians. It took 2 years before he finally let me do it. He gave me like 15 minutes. It's not easy, but you know, people do change and come and go. So I just want to say, don't give up. You need to be empowered, but you do have to have that administrative support to make some changes as well. It's helpful, especially at the building level with principals. I mean, I had a principal one time say, no, you can't form a, this is going back almost 10 years, that you can't form a schools committee because what if they find something and then they didn't want something to get into the paper, or they look at it the wrong way. And so I think it's important that we educate people and make it not seem so threatening, I guess is the key message there. Next slide. I love this little guy's little machine. I don't even know what you call it, but his name is Pat, and he's from Washington State. And actually, his machine, he calls him it's Bang, and he makes cleaning fun. And he actually was the first, the recipient, I believe, of the first. What was the award? Where is it here? I'm sorry. It's from Washington State, and he won the CLEAN. It's the Custodial Leaders for Environmental Advocacy Nationwide Award, and he was like one of the first recipients in Washington State. And I just think I would love to work with him. He likes what he's doing. He's probably doing an excellent job, and that's really important. And then my last slide. Well, second to last slide. This is a picture of my custodial staff. Actually, the woman on the right, Debbie, she is the head custodian of my building currently. She's great, but she still could, needs some education. Let's put it that way. But that's Joe on the left, and that's Joe. He was the guy I was talking about earlier who is now disabled. He's not working. I believe he did have his lung transplant, but he's not even. I don't even think he's 50 years old yet. So it's pretty sad that part of what caused his lung disease was an occupational hazard from the chemicals that he was using. And then my last slide just is some resources. Just different websites and so forth for some resources. And that's my presentation. Thank you.
Great. Thank you so much, Linda. We really appreciate it. And, of course, we will have your slides posted, including the resources that you show. So thank you so much. And I think one of the things that's so valuable is having the involvement of a school nurse advocate in your school. So at any school out there, reaching out to your school nurse can be a really important advocate for supporting healthy cleaning programs. So having said that, I'm about to introduce our next speaker, Deb Stafford. Beforehand, let's do another poll. Got a little quick question for you. What do you think is the biggest benefit of having a green cleaning program in your school? Answer that question. In the meantime, let me introduce Deb. Deb Stafford is the Director of Housekeeping at Green Chimneys Schools, and she's currently leading Green Chimneys Green Cleaning Program. Green Chimneys School is world-renowned for its animal-assisted therapy program, residential treatment center for children, and accredited special education school. The cleaning program at Green Chimney Schools received honorable mention in the 2010 Green Cleaning Awards for Schools. So let's take a quick look at the answers, or at the results of the poll. And as we share, it looks like all of the above is pretty close to unanimous. So I think we're all in agreement there. So, all right, so thank you so much. So having said that, oh, wow. Let's now introduce Deb Stafford. So, Deb, the floor is yours.
Thank you very much, Mark, and thanks for the chance to share what we know with all of you. First, let me begin by sharing with you some information about Green Chimneys. Next slide. Green Chimneys School has always been an environmentally concerned community. Beginning as a farm and summer camp over 60 years ago, Connection to the environment has been a cornerstone of our policies and procedures over the years. Working with animals as a way for emotionally injured children to open up, connect, and heal, environmental stewardship remains a major component of Green Chimney School's therapeutic milieu. Next slide, please. As Mark said, in 2010, Green Chimneys was an honorable mention in one of the first Green Cleaning Award from American Schools and University magazine. That was really a big hit as far as making an impression here at the school with administrators to let them know that we were serious about what we were trying to do, and it was respected not only in the industry but in the world of schools and universities itself. Today I'll share some of the ways we all work together to achieve the recognition for our green cleaning program. Next slide, please. Over the years, Green Chimneys has grown to almost 50,000 square feet of cleaning area. We have more than 200 students ranging from ages of 5 to 18 that come to Green Chimneys from around 50 different school districts. They're all bused in. We are 60 miles from New York City, and we have a rural country landscape. Green Chimney School is designed for students from kindergarten through 12th grade who have been unsuccessful in a traditional educational setting. Most of these students require a small, structured, and therapeutically supportive environment. We have a farm, horse barn, and organic garden that are all part of the successful therapeutic animal-assisted therapy and nature-based programs we provide. Next slide. We believe working with animals is a way for emotionally injured children to open up, connect, and heal. The nature of our business also means we are exposed to germs, and lots of them. So it is imperative to work with the school nurses as part of our green cleaning program. School nurses have provided us with feedback on how we can help them support their job, and they provide us with feedback on how we can support them. Nurses can assess the school environment for risk factors, advocate for the school community to address environmental pollution issues, and educate the community. We really value their input. Next slide, please. The campus itself consists of more than 30 buildings, each requiring different levels of cleaning and disinfecting. Next slide, please. Our green cleaning policy is enforced throughout all these buildings, from the health center to the dining hall to the classrooms to the greenhouse. Mark, can you change the slide?
On programs?
There we go. Yeah. No, back to where we were, the map. I'm sorry.
On communication? The map, sorry.
That one. There we go. The campus itself consists of more than 30 buildings, each requiring different levels of cleaning and disinfecting. The offices require less disinfecting than, say, the health center or the pool gym would. The school building might need a little kind of different type of disinfecting and cleaning as the farm would. Keeping surface soils clean and out of these locations is one of the first steps to being able to maintain control of your cleaning environment. Our green cleaning policy is enforced throughout all these buildings, from the health center to the dining hall to the classroom and the greenhouse. By using just a few green cleaners, and closed-loop dilution systems, the Environmental Services Department implements safer, more efficient cleaning procedures. Okay, now we're on to the programs. Next slide, please. Students do not stay in one classroom. They travel to the library and the dining hall, as most students do. The gym, pool, and locker rooms are also highly visited throughout the day. Students practice yoga and play basketball in the gym. The pool provides swimming lessons not only for students, but our Nature's Nursery child care program and the public. The local high school swim team meets in the morning for practice. There are a lot of opportunity for infections to travel from person to person, both on surfaces and airborne. And as Linda was saying earlier, the way we maintain infection control is by not fumigating everything. We just keep tabs on the high-touch points, such as you can see, we keep books and computers and hand cleaning and hand hygiene. That's one of the more foremost things that we stress here at Green Chimneys. By far, the favorite place to go here at Green Chimneys is the farm. Students have hands-on experience with the animals. They feed them, they take care of them, and help to keep their stalls and cages clean. We have horses, cows, big pigs and little pigs, injured birds, chickens, several llamas, and recently 2 camels were given to us in a humanitarian exchange program. Next slide, please. So how did we encourage and involve all of the different types of people we have here at the agency? In order to communicate these new cleaning policies and recycling efforts to the students, the staff, even board members and the public, we utilized our internal newsletters, school morning announcements, campus meetings, magazine articles. We often have large public events, and recently, this weekend, as a matter of fact, we'll be holding our Birds of Prey fundraising program, and that's an event where we emphasize recycling and have the public here on campus. It's a really great way for us to improve our visibility as a green organization in the community. Next slide, please. Innovation and training. Innovative new cleaning machines improve morale and greatly reduce both chemical and labor costs. Our guys love using machines. I'm going to have to see if they have a trick out contest based on that last slide that Linda showed us. We've got a kick out of that one with the tiger. That'll be a fun contest here. The training continues with respect to equipment safety, infection control, and new technology. Custodians and janitors are very vested in the outcomes of their work, and training helps them to become experts in the field. Next slide, please. Nurses can influence the environment of their own offices by updating and making improvements. Linda was talking before about having nurses that be advocates for a green cleaning program, and I would have to highly agree. During recent renovations, we spoke with the school nurse about updating her office. She requested hands-free, touch-free sinks, soap dispensers, and paper towel dispensers to be placed in strategic locations. I love the way she describes the issue when she was requesting these things. She was very animated and would talk about kids coming in with bloody noses and they just touch everything, and she would touch all the lamps and the doorknobs and each other, and she was very strict in making sure that we helped her out by providing the latest technology as far as reducing infection control. She also made a big request to have the HVAC systems routinely serviced and cleaned as a way to reduce dust and allergens. Based on the fact that we have the farm here, there are many roads and pathways that are not paved, and so we do kick up a lot of dust. So by having the HVAC systems routinely cleaned out is helpful for all the students and staff who have asthma or might have other troubles with their lung function, as well as helping reduce dusting for my cleaning staff. Though our goals for green cleaning are all-encompassing, the most influential things that we do include reducing toxic exposure, reducing pollution, increasing recycling, using Reseal and EPP, which is environmentally preferred product purchasing, efficiencies, cost savings, and increased awareness. If you are a facilities manager, I would encourage you to talk to your school nurse about how you can support one another's work. Most states and school districts have also posted recommended green cleaning products and procedures. There really is a wealth of information out on the internet. Healthy Schools Campaign is one, and Healthy Schools Network. You do a little. If you have any questions, you can contact us to let us know what questions you might have. Next slide, please. So, in the end, you can't educate a child who isn't healthy, and you can't keep a child healthy who isn't educated. This was said by the U.S. Surgeon General. So, the goal that we have, and most other people involved in the environmental health of the children and people around us, is to help our students reach their maximum academic, behavioral, emotional potential. And we can do this by ensuring every child has a healthy school. Clean, quiet, well-lit, and dry with good indoor air quality. Just as important is an administration that can swiftly address environmental hazards, including mold or pests, mercury, and infectious disease. School nurses are great gatekeepers in maintaining and influencing policy regarding the safety of all students throughout all the schools. And I encourage everyone working together. And that's it. Thank you very much.
Great. Thank you so much, Deb. I was so intrigued by the conversations that we had earlier about your engagement with the school nurse when you were developing and implementing your green cleaning program, and how influential they were in thinking through how to reduce touch points. So I really appreciate all of your input. So thank you so much.
Thank you.
We are now going to go into a question and answer session. I do just want to really quickly point out, as Deb mentioned, she's one of our past Green Cleaning Award winners. If you all are part of a school, work with a school, or know a school that is implementing a green cleaning program and are interested in getting recognized, please share the information. Our Green Cleaning Award for schools and universities application is out. You can go to our website or go to asnumagazine.com Green Cleaning Award and check it out, download the application, and get it in. They are due in September, and we look forward to always highlighting the great innovative work that schools are doing across the country. So we hope you will share that information broadly. At this point, if you have a question, let us know. Type it into the question box. I know we have a whole bunch already. If you have a question later, you can always send it through Twitter with the tag GreenClean2013, and we will do our best to get it to you. In the meantime, I'm going to hand over the reins to Alex Scheibel in my office to go through the questions. So Alex, it's all yours.
Great. Thank you so much, Mark. And as Mark said, please feel free to keep sending in your questions during the question and answer session. So we will jump right into it. The first question is for Linda or Mark, from somebody that is trying to start environmental health programs in their schools and is having trouble communicating the connection between asthma and green cleaning, and would love either resources and or tips on how they can communicate with their administration about why green cleaning is important to reducing asthma.
Linda, why don't you give that a start?
Okay. Well, I mean, I think data is always helpful in building a case for something. So, you know, if you have any data, whether it's absentee data, school nurse log visits, you know, that kind of thing. I know here in Rhode Island, we actually, the Department of Health did some work. It's called Providence Plan, and they are doing mapping and looked at ER visits. We got insurance claims data, looked at ER visits and hospitalizations, and we're able to look at hotspots on a map of schools in the areas where schools were having lots of children being admitted and so forth. Not that to say that that's just the school environment that's causing that, but, you know, it's certainly a part of it. Looking at, you know, just the environment, doing a walkthrough is good data to show, you know, that there are some problems. So, you know, educating them as to what, you know, asthma triggers are, and then looking around your building to see, you know, are there those triggers there, because they're definitely going to impact the student.
Can I jump in here?
Yeah.
Can I jump in here, Mark, for a sec?
Yeah, jump in.
One of the things I found extremely helpful in helping me organize and get around things I needed to do was the IAQ Tools for Schools Action Kit from the EPA. It's a package about 2-inch thick, and it has a DVD, it has a quick problem-solving wheel, lots of information about asthma, checklists to take through your buildings, coordinator forms, how to put together a team, reference guide. Everything you really need to get started is there, and it's from the EPA, so you can just Google that, and it's IAQ Tools for Schools Action Kit, instrumental in proving the asthma issue.
Yeah. And then I'll just throw in a plug for our quick and easy guide to green cleaning in schools, which you can order copies of. It's a web-based tool, but you can also download a brochure that gives summaries of the rationale, the reasons, and the importance of implementing a green cleaning program. And you can go to greencleanschools.org for that resource. So, Alex?
Great, thanks. The next question is for Deb, from somebody wanting to know how you started your green cleaning program. What were some of the very first things that you did?
Well, one of the very first things I did was get promoted to this position. That helped me be in a position where I could make some changes. The housekeeping department had previously been very old school. Bleach was a mainstay. We had housekeepers who had been working here for 20, 30 years, very set in their ways, taking care of the children in a smaller type environment. But as we have grown, we have new buildings, which have new needs. And again, after I got a little organized on getting things together, working with my vendors was very, very important. I had a consultant that I worked with who knew a lot about different green aspects working with schools. So I would suggest working with your vendors to see how they can help you. Then going ahead and just slowly implementing things, making change. Change is hard, and sometimes you have to manage it. And now we've been doing this now about 5, 6 years, and it's very, very well appreciated throughout the agency. So I would say, again, do things like get the action kit, do some Googling, talk to your vendors, and just start making some changes. Mm-hmm. You're empowered in your position to be the expert. So act like it, I think, is one of the things that helped me.
And this is Mark Bishop, and I'll just I want to echo what Deb said. I think I would agree with everything that she said. I just also like to emphasize that your champions for green cleaning can occur in any place, and where one school starts and the other one starts can be 2 different places. Whether your leadership is within custodial services in the facility department, or whether your champions are parents, your school nurse. Mm-hmm. Or even the resources from, as you mentioned, your distributors. Distributors are great resources for identifying resources for better, healthier products, as well as better training. So don't forget about your distributor, because, again, they essentially want to make money, and if they can make money providing better, healthier services, all the best for everyone involved.
Great, thank you. And a follow-up question to that is from a school nurse saying that they do not have a green cleaning program in their school but want to know how they can get started. So maybe, to speak about the flip of that, if you're a school nurse and want to get going with a green cleaning program, what might be some of the first things you would do, and who would you talk to?
Linda, what do you think?
Well, I think that again, it goes to that administrative support, and so, absolutely, if you, are empowered to do that, I would certainly start with a facilities manager in the district that you work, and, talk to them and see if they're open to that, and working together, like Deb said, it's that teamwork, working together to make something happen. So, it can start at the building level, but again, I think it needs a little bit of district too, because the district is the one that's ordering supplies and doing things, and maybe going to your custodian first in your building and then going to that facilities manager is important. Because you can't do it alone. You need the support and need the help, and you need everybody to be on board. So I guess that's what I would do.
One of the things I would suggest, too, is start easy with, like I started by replacing toilet paper and paper towels with the recycled chlorine-free larger roll tissues from my distributor, and that really helped. I made a big deal about that as far as, well, these are recycled products, these are green, putting little stickers on those, and that was something I could do on a large scale without really impacting too much questions about chemicals and the environment and all of that. Everyone knows about paper recycling, so that was one of the first ways I started to see the green idea.
Yeah, I'd also want to add too that it's baby steps. Like, you know, it's not going to happen overnight, so don't be, you know, don't get discouraged, I guess is what I'm trying to say. You know, you might need to take it slow. Like, don't think you're gonna, you know, like I said earlier too, don't think you're gonna change all the cleaning products you use all at once. It's you know, it's a process, and but taking it one step at a time, I think is important, and taking it slow, yeah, it's definitely good.
Great, thank you. And then this question, Deb, you might be able to kick us off on this one, is from somebody wanting to know how you deal with areas that are more prone to infectious disease, and then also food prep areas. And are you required to use antimicrobial soaps in those areas, and how do you clean differently in those places?
Well, we use a no-touch cleaning system using a disinfectant, and we just flood the locker rooms with that and make sure every little thing gets taken care of using a disinfectant and no-touch system. I've been trying to phase out the use of bleach in the kitchen areas by, again, using a friendly disinfectant, because those things are required to be disinfected. You don't really have a choice. So I try to make it a little nicer for them. We use a product that smells very spearminty, and making little changes like that seem to help. Not waxing the floors, keeping all the dirt out. Those kind of things can help visually. But again, I think targeted disinfecting, especially, you know, we have a farm here, and kids are trained to wash your hands, wash your hands, wash your hands. We have really fun posters that are posted up at almost every sink in the agency, and talking about how to properly wash your hands, and these are germs, and how long germs can stay on your hands. And we also use a lot of the soapless, waterless type of hand sanitizers, foam hand sanitizers in places, because, as we all know, children are not 100% experts at washing their hands. It just makes it a little easier to use prevention as opposed to reaction. That would be my suggestion.
Great, thank you, Deb. I think that's a great response. And then a question for Linda. A number of people loved your data and want to know where it came from so they can use it in their own presentation. So do you have, are there sources of places that you go that you find have good statistics about these issues? Specifically, people were interested in the statistics you reported on asthma, that 20 million people have asthma.
Right. Yeah, the CDC's website and the Lung Association, like that absenteeism is from the Lung Association. So those two, I would say those two websites are probably the best for getting data on asthma.
And what about the data on the workers and toxic cleaners? You said you had a stat saying that 194 pounds of chemical each year are used by people.
Right. You know,
if you don't know, that's fine. We can send out that information.
Yeah, I don't. I have to go back into my my stuff when I was. Yeah, I don't have it off the top of my head.
No, that's fine. It sparked a lot of questions that people want to use it. So it's a great statistic. Wonderful. And another question is, do either, Deb, do you have any facilities, or Linda, do you work on any facilities that are LEED certified?
Yeah, I do, yes. I have the pleasure of announcing that. Yeah.
Deb, do you want to go first and maybe speak a little bit about what that means and how that factors into your green cleaning program?
Absolutely. We just built 3 new dorms. We are a residential treatment center for 88 children. We have 88 beds here. And the architect that we worked with will not design anything unless it's LEED certified, which is, if I could remember exactly, leadership for the environment and design, something like that. I should know that by heart, but I don't. And the LEED situation is you get points for doing certain things when you're building. This was new construction, which is considered NC, new construction, but you can also retrofit things and use LEEDs to help guide your improvements. But in any case, we were building brand new dorms, so it was a great way to start from the ground up. LEEDs requires that you use low VOC content paint. We use banana fibers on our countertops. Our counters themselves have no formaldehyde. There's no waxing in the floors. Even the cinder blocks are made from coal ash, which is a recycled product. A lot of the building waste, the construction waste, needs to be recycled, and that all has to be measured very carefully. It is a big undertaking. It's a big undertaking, but it can be done. And you can just go to LEED, L-E-E-D, and see what pops up. We were granted a LEED Silver certification, and we have some signage in the dorms that say some of those things that I just mentioned about water conservation, air quality, using recycled materials. There's several little areas of which you can concentrate in order to get LEED certification. It's a big process.
Great. Thank you, Deb. That was a really fantastic answer, and congratulations on getting through those buildings certified. Linda, did you have anything to add?
Just that I unfortunately do not work in a facility like that. I wish I did, but I am familiar with a couple of schools in Rhode Island, actually in the capital in Providence. One is a brand new building, a career technical center. It's absolutely state-of-the-art, gorgeous, and it's all LEED certified. And they recycle their own water. They do, it's just like unbelievable, that place. And then an older building, they actually renovated by using the criteria for LEED, and it's absolutely a beautiful building too. What they were able to do, we actually used that building to host a field hearing. One of our U.S. senators did a field hearing on asthma a year ago during Asthma Awareness Month. So that was kind of cool to actually do it in a building that was just renovated and stuff. So anyway, that's my experience.
Great, thank you so much. So I think we are at 2 o'clock. So we are going to go ahead and end the webinar, but wanted to thank everybody who participated on the webinar, and special thanks to our speakers for both sharing, taking the time to speak on the webinar, and also for all the wonderful work that you're doing in your schools to support healthier school environments. So thank you, everybody. If you can join us for the other webinars this summer, we would love to have you there. Great.
Take care.
Thank you.